Hello everyone, this is the third recording for module number 2. The topic is needs analysis. We first looked at what is needs analysis, its purposes, and then the design and process for completing and conducting and completing the needs analysis. Needs analysis or needs assessment is a method to estimate deficiencies. So if we have enough services, there's no needs to be addressed, then there's no need for needs analysis. It's an effort to determine what the needs are, an activity that identifies gaps and insufficiencies. So there's a need, and also looked at the service gaps or insufficiency in service provision as well. It's an activity to develop a comprehensive picture of the health of a community, areas, and service, and thus guide the choices about the source of health intervention which can be introduced. What that means is when you're planning for a service in an area, you will look at what's currently available, what's not available, so you can determine what additional health interventions are required. Examining the viability of the proposed project in terms of its costs, legal feasibility, and any unique environmental or cultural issues that might prevent the project from being successful within a particular population group. So this is common when we have piloted. So for example, we have piloted an intervention or a project in one area with a particular population group. Then we will look at, and it is proven successful or effective in a way in addressing the issues. Then we will need to know whether this type of intervention and project can be replicated in another geographic location with a similar population group. So you might need to conduct a study to look at whether it's feasible for the replication, and if its replications can go ahead, what revisions are required. So needs analysis could be broad range of activities, but it does have specific focus, which we come to it. The more important question for needs analysis is, why do we need to conduct a needs analysis? Who will use the needs analysis? When we've done that, who are using them? Because you are conducting a needs analysis for certain purposes. So the questions you ask, the report that you generate, had to be targeted. How will the needs assessment or analysis be used? So is it for advocating or securing resources? Or is for providing evidence for modification of policy and procedure? Or simply proposing service improvement? Or establish a new partnership, or establishing a new project, or new service models. So there's different purposes, different questions that we ask that will shape the needs analysis very differently. So what would be the best evidence to convince skeptics of need for the desired program? So we want to propose a new program. Through the needs analysis, we collect the best evidence to convince people this program will work and it worth funding. What evidence could convince the decision makers? So this is the thinking we need to have for needs analysis. And what evidence would mobilize the community to recognize the problem? Sometimes it's not about there's no services, it's about services not being accessed by local community. So needs analysis could generate evidence that what can improve the accessibility of the services to the population that we target. So when we design a needs analysis, first step, we need to know what's the population, community, or group that we are referring to in terms of the needs, and what types of needs are in scope. You're talking about in need of specific services, or you're talking about a problem need to be solved, or a disease have been identified that no services are available, or there's not clear the best intervention to cure or treat the disease. So we need to know more about the types of needs in scope. What is the service system capacity? Yes, there might be needs, there might be service requirement. However, Are those local services in the capacity in addressing them? Do we need to introduce a new service, new organization in order to provide the service? So this is also important questions to ask. What's the latent plus unmet need? So when you conduct the needs analysis, not just looking at what's in presentation to you or in present, but also look at the latent and unmet needs, so that when you propose a new service, the service have the capacity to fully address the needs you can see or you can't see yet, or people are not aware that they do have the needs, but when the service become available, that you may trigger the mediation of the such services. So what barriers and obstacles to change exist? The question is, if the problems exist for a while, why those problems have not been addressed? Maybe we have tried in the past years. Maybe there are obstacles to be overcome. So when you conduct the needs analysis, we need to understand all this. We do not want to propose a new intervention, propose a new service without knowing the obstacles. Otherwise, that will eventually lead to the unsuccessful implementation and development and implementation of services. We also need to know what the nature of the problem being investigated. So now we're about to investigate. There's a problem that's needs. What are they? To understand the problem and the needs, what are the data that's already available that can generate useful information for us to make a judgment, the urgency for addressing these problems, and the feasibility of addressing these problems, and the capacity of existing services in addressing these problems. Are there any available resources? Conducting this analysis requires staff, time, and other specialized skills. Sometimes maybe equipment, software to analyze the data, etc., etc. And what the timeline? For example, if the funding application may become available within 2 weeks or 2 months, then the timeline will be likely you have up to 1 month to generate this useful report for the organization to consider whether a funding application is feasible. Then you have adequate time to develop that application based on some of the information that you provide in the needs analysis. So the amount of time allowed also important, and also of course that's limited by the resources that allowed. The longer the needs analysis take, the more staff hours might be required, then cost more. The purpose of the needs analysis needs to be clearly defined by asking the right questions, and the scope of the project service program to be supported by the needs assessment. If during the needs assessment process there will be intervention to be proposed, are they in a pilot form, or are you proposing a long-term services, large-scale services? So that needs to be clearly defined as well. So when we think about how we decide in this analysis whether it's worthwhile to go ahead and doing that, we need to consider a number of factors. This diagram just captures what we just discussed early on. We need to know the time frame for the needs analysis and what are the available resources for supporting the needs analysis. What are the ethical considerations? So by asking the right questions, by asking not misleading questions, then we generate evidence that are neutral, that's independent, and also recommending services that are acceptable to the population that we target through an ethical procedure. And what's the purposes of the overall needs analysis? What's the outcome, likely outcome of conducting needs analysis? How it's being used? So the 4 major areas that we also need to investigate, in addition to the needs that need to be proven that's urgent enough and significant enough to be addressed and the problem to be solved, we also need to look at locally or nationally what type of services that currently available to addressing these problems. what are the awareness of services? Sometimes the services are available, but people are not aware of it. Therefore, there's accessibility issues. So it's not then the problem not be solved. So the issue is not about no services are available, but about the services are available but not being accessed. Accessibility of services and acceptability of services. So this is the 4 focal points for needs assessment. We need to understand all these factors before proposing whether new services should be required, or we need to develop some clear pathway, referral pathway, promotional strategies instead. Importantly, we need to know how needs analysis fit into the organizational context. This is, of course, whatever we propose to do will be under the umbrella of an organization. So therefore, the overall goals of doing what we do should meet the organization's strategic directions and also accepted by the organizational practice. Please keep in mind the ways that we ask questions when we conduct this analysis make a difference to the findings. Just look at these different questions that we ask. What support services are available to patients who recently completed chemotherapy? Do patients in need of support services have the access to the services in a timely manner? So what likely you will find from these questions? We find out these questions already limit what we investigate is within the umbrella of support services. So we find out the types of support services that are required and currently available and that are required, and whether it's being accessed by the patients, are available to patients. The second question, what do patients need the most after the completion of chemotherapy that can maximize the treatment outcome? Are these services available as required? So this is a much broader question that asks. Firstly, we did not limit to the type of services that are required, but limit the type of services as linking to treatment outcome. So any services after chemotherapy that can maximize treatment outcome. Then we also investigate whether such services are available. The third question, what are the gaps in follow-up services to patients who have completed chemotherapy within a 6-month period provided by Wonderland Community Health Centers? So this question is also a shifted direction as well. It's focused on follow-up services within the 6 months period in a geographic location. The fourth, what are the specific needs of patients who have recently completed chemotherapy that couldn't be addressed by developing an integrated linkage referral pathway between Wonderland Hospital Cancer Service and the current Wonderland Community Health Services. So this question is about the needs for specific referral services. So you can see the way that we ask questions that will determine the findings of the needs analysis. So the design will be very different. So to reinforce that then means to design a needs analysis, the most important starting point is to determining the question that you ask that will guide the design of needs analysis. So needs analysis is to determine the needs of a particular group of community. It should be focused and targeted and specific. So the questions are clear to guide you to design what to do next with ethical consideration. There's many ways that we conduct the needs analysis. We can hold focus group within an open-ended manner to discuss the issues among a group of people. Can be consumers, can be service providers or carers. We can hold a committee forum. So that was just the 2 questions as an example can be discussed among the focus groups. So we can hold committee forums. So we call representatives of the community to come into a forum time to discuss various issues. And in a could be in a very structured way. We can conduct survey, could be online, could be face-to-face. Face-to-face can be assisted completing, so means we have sent our staff to ask the question and complete that on their behalf, or we can hand out the hard copy for them to complete. Could be small targeted surveys or large probability surveys, so depending on the availability of resources and needs. And in addition to conducting activities that will come into contact with human beings, we can also use data that already exists, such as the population data, demographic, health status, and service system response data from the department or specific organizations, agency data, so the data from the specific organization. So just keep in mind, using unobtrusive data is not an alternative design, but a design that can enrich the needs assessment process. So we could use both ways, a mixture of both ways in collecting the data, rather than this one or the others. So what's the process to be included in the needs analysis? So this is the 7 steps. Firstly, we conduct a system and service review and to see what the gaps are, what the problems in presentations. Then we need to identify what are the key stakeholders that will be impacted by the problem, or if the problem needs to be solved, who should be involved. So then we can conduct the initial consultation. Then we form a needs analysis, needs assessment team, and we need to finalize the design. Then we move on to data collection and data analysis. Based on the information, we will not only identify the needs, but we also identify what type of service is currently available, serving or having the capacity in solving the problems, or there are no services available at all. Then we can quantify the service gaps. Then we can prioritize the needs to be addressed. So these are the steps that we need to complete as part of your needs analysis. So basically, what you provide at the end is evidence confirming there are needs to address or problems to be solved. What are the existing services and the urgency of solving these problems, addressing the needs. Are there any available services currently addressing these problems? And reasons why the problem is not fully addressed if the services are available? What the existing service capacity if expansion of services are required? Or what's the capacity of existing organization in the areas if new services are to provide? Then we will determine what's the best solutions for addressing these problems. So issues that we need to consider in needs analysis could be, from a technical point of view, the data available, time, resource limitation, also political and strategic considerations. So we need to consider whether the resources will be available for the proposed new services. Do we have the capacity in doing that? There's no point to propose something that we are not able to do that, or we cannot secure resources in doing that. What's the interest of current funding bodies, the committee groups, potential donors? Are there any staff limitation? Are there within the organizations, if we are proposing additional services to be provided by the organizations, do we have the capacity in doing that? In the local community, do we have the capacity in doing that? Will we have problem in attracting those specialized skills? So this, all of the consideration we need to have when we're designing a needs analysis. And do not conduct needs analysis when the allocation of funding resources based on direct or indirect formula for specific service outputs. So the decision's already been made, so there's no point to conduct needs analysis to convince anyone. no reallocation additional resources available. That means it doesn't matter how well they conduct your needs analysis, what you propose will not get funded because there's simply no resources available. Inadequate support is projected, so you are proposing services that may not meet the strategic focus of the organizations or the current focus of the government, or may not be a welcoming idea in the local community. So and therefore you cannot get adequate support for the proposed intervention services. Then there's no need for such analysis to be completed. So this is just a overview of what's normally to be included in a needs analysis report. One is you need to have a background introduction, so to brief readers what prompted you to conduct the needs analysis, what are the purposes, what is the design and plan, so we can make a judgment of whether the steps you took did generate valid and reliable information for decision makers to consider. What are the key findings, that including the needs, the problems, the scale of the problems, the population groups that are being affected by the problems, and what are the most effective strategies that should be proposed, and maybe how effective and efficient those strategies in solving these problems, and what's the existing service availability, what are existing service gaps, and the capacity of existing services in addressing the issues. And you have a discussion and findings to draw a conclusion of what are the service requirements, what are the best approaches to adopt, and the urgency of adopting these approaches in addressing the problems. So this is just a brief presentation of what needs analysis should be, and hopefully you can conduct your reading, and then by next week I'll record a separate recording to discuss the requirement of your first individual assignment for online student, which is closely related to needs analysis.